Okay, so today in this video I'm going to be showing how to suction a tracheostomy open system. So first what we would do is we would bring the necessary equipment to the bedside stand and over the bedside table, and we would perform hand hygiene and put on our PPE. And we would identify the patient. Since I don't have a human patient to perform this on, I'm going to use this water bottle. And we would determine the need for suctioning and also assess for pain and administer pain medication if it is prescribed to the patient. So then we would adjust the bed to a comfortable working position, place the patient, if they are conscious, in semi-Fowler's position, or if they are unconscious, we would place them in a lateral position facing us. So then we would place a towel or a waterproof pad. I have a towel here for demonstration purposes. So we would place it over the patient's chest. And then we would turn the suction to the appropriate pressure. And we would put on a disposable clean glove and occlude the end of the connecting tube to check the suction pressure. And then we would place the connecting tubing in a convenient location and place a resuscitation bag connected to the oxygen within our convenient reach. Okay, so after that, we would then open our sterile suction package using aseptic technique. So here is our sterile suction package. I already have my sterile gloves on, and we would open it from one side, this from one corner, and the open part of the container can be used as sterile as well. So then we would carefully remove the sterile container, touching only the outside surface, and set it up on the work surface and pour our sterile saline into it. Pour the sterile saline into here. Okay, and then we would put on our face shield or our goggles and mask and our sterile gloves, and the dominant hand will touch the catheter and it has to remain sterile, and the non-dominant hand is considered clean rather than sterile, and it will control the suctioning valve. So with our dominant gloved hand, we're going to pick up the sterile catheter. We're going to pick it up. Second. Okay, and we're going to first drop it onto our sterile field and pick it up with our dominant hand. And then we are going to moisten the catheter by dipping it into the container of sterile saline. So I'm just going to place it down. I picked it up with the wrong hand. Okay, so we are going to now moisten the catheter. Alright. And now, using the non-dominant hand and a manual resuscitation bag, we would then hyperventilate the patient, delivering 3 to 6 breaths, or using the SI mechanism on a mechanical ventilator. Then we would open the adapter on the mechanical ventilator tubing and remove the oxygen delivery setup with our non-dominant hand. And with our dominant hand, we would quickly insert the catheter into, so this would be the trachea. We would quickly insert the catheter into the trachea. And then we would advance the catheter to the predetermined length and making sure to not occlude the Y port while we're doing this. Alright, so then we would apply suction intermittently. So then this is when we would take the Y port and apply the suction intermittently. And we would gently rotate the catheter as it is being withdrawn. And we have to make sure not to suction for more than 10 to 15 seconds at a time. So at this point, we would then hyperventilate the patient using our non-dominant hand and a manual resuscitation bag, and deliver 3 to 6 breaths again. And we would replace the oxygen delivery device using our non-dominant hand and have the patient take several deep breaths. And if the patient is mechanically ventilated, we would then close the adapter and use the side mechanism on a mechanical ventilator. Okay. So then we would flush the catheter with saline and assess the effectiveness of the suctioning, and we would repeat as needed according to the patient's tolerance. We would then wrap the suction catheter around our dominant hand between attempts. So we would allow at least 30 seconds to 1 minute intervals if additional suctioning is needed, and you have to make sure not to make more than 3 suction passes per suctioning episode. And we would also encourage the patient to cough and take deep breaths in between suctioning attempts. So when the suctioning is done, we would then remove the glove from your dominant hand over the coiled catheter. So we would remove the glove, dominant hand over the coiled catheter. I messed that up a little bit. Okay. And we would and then we would dispose of the gloves, the catheter, and the container with the solutions in the appropriate receptacle. Then we would assist the patient to a comfortable position, raise the bed, and place the bed in its lowest position. And we would turn off the suction, remove the supplemental oxygen, and remove the face shield, the goggles, mask, and perform hand hygiene. We could also offer oral hygiene after suctioning and reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds. We would also remove our protective equipment at this point and perform hand hygiene.